from refusing you coverage because of your medical history. 2, it will end the exorbitant out-of-pocket expenses, deductibles, or co-pays. Insurance companies will have to abide by yearly caps and how much they can charge for out-of-pocket expenses. In other words, you will know before you sign up for a plan, you will know what your annual out-of-pocket or deductibles will be at the beginning. And so you
No, you don't.
You can comparison shop.
Everybody
3, there
knows
will be
that.
absolutely no co-pays or deductibles for preventative care. This is what I put into the bill. Well, it was my part of it that I developed. That means that if you wanted to go in for screening or immunizations, mammograms, foot care if you're pre-diabetic, or colonoscopies, these will not have no co-pays or deductible. Every insurance program will have to cover those. I talked to a man in Northwest Iowa last week who has a small business. He has 12 employees, and he has a policy for his employees is $5,000 deductible. And he just turned 50, and the doctor advised him to get his first colonoscopy, but it was $3,000. So he has to pay that out of pocket. And having just had a friend of mine who is on his deathbed because of colon cancer because he never got a colonoscopy. And we know this is one of the cancers that's easily curable if you get it early, just like mammograms. If you get it early, you can really stop it and cure it. So the idea being to encourage people to seek preventative care, to get in as early as possible and stay healthy. 4th, insurance companies will be prohibited from dropping or watering down insurance coverage if you become seriously ill, which they can do right now. You can become ill, then when your plan is up for the next period, they can just drop you if you had a they won't be allowed to do that under our bill. 5, unlike in the current system, insurance companies will be prohibited from charging you more because of your gender. Right now, insurance companies do charge women more, and they do it on the basis of gender, and they will not be allowed to do that. 6, insurance companies will not be allowed to place annual or lifetime caps on the coverage you receive, which, again, a lot of people who get seriously ill, they bump up on their lifetime cap, and, well, that's it. They don't have any place to turn. 7, children will continue to be eligible for family coverage through the age of 26. And 8, people will have guaranteed insurance renewal. In other words, if your policy's up, there's only one reason that they can't renew your policy: if you don't pay your premiums. No other reason, no other health reason than can they refuse to renew your policy, as they do now all the time. So again, these are very big reforms, both in insurance, but also in wellness and prevention, and I think that's going to make a huge positive difference in the lives of ordinary Iowans. Now, let me just say something near and dear to my heart, and that is the new emphasis on wellness and prevention. I think it will jumpstart the transformation of our system. I have been saying since 1992, when I think I first coined the phrase, I don't know, when I said we don't have a healthcare system in America, we have a sick care system. Everything is geared towards patching, fixing, and mending once you get sick. All the incentives are on that side of the ledger. What I think we got to do is push more of these incentives to keeping you healthy and well and out of the hospital in the first place. And that's what we're trying to do with our wellness and prevention part of it. Our aim is to recreate America as a wellness society, a society focused on healthful lifestyles, good nutrition, plenty of physical activity, and preventing the chronic diseases that take such a toll on our bodies and budgets. 75% of spending on Medicare now are for chronic illnesses, most of which are preventable. Now, for example, we will require reimbursement for proven cost-effective preventative services, as I said, such as cancer screenings, nutrition counseling, smoking cessation programs. That means health professionals will be able to offer these services to patients before they get diseases, such as diabetes, cancer, or emphysema. Like right now, insurance companies, as well as Medicare, I might add, will pay $30,000 to amputate your foot once you get diabetes, but they will not provide any kind of counseling if you're pre-diabetic to keep you from getting diabetes and to keep you well. So again, your mother was right. An ounce of prevention is worth a pound of cure. So these are the things that we're trying to do in a lot of different, but I just wanted to focus a little bit on that prevention and wellness, because I think really, to my way of thinking, about the only way we're really going to save money is if we start focusing on keeping people more healthy in our country and prevent these diseases in the first place. So I urge all of you to look at the bills and cut through a lot of the clutter that's coming out of Washington now, and be skeptical of those who try to scare you with a lot of half-truths and some of the ads. I'm not mentioning anybody. I'm not mentioning anybody. I just saw an ad yesterday. I was sitting in the barber chair, and I saw an ad, and it was pretty devastating. But then I saw who paid for it. It was GOP something or other.
And the DNC hasn't done anything?
I'm just stating what was on the TV. It was a pretty scary ad. And quite frankly, I don't think that does service to really legitimate, open debate.
It doesn't have a two-sided debate.
So I'll just say we need reform, because I think the status quo is unacceptable. I think we will succeed because failure is not an option. And with your support, we're going to create a reformed insurance and health system that works for all of us, not just for a few. And I want to thank all of the people here at Primary Health Care and at Iowa, Nebraska for all the great work you do. Thank you very much. Thank you. I just apologize for that. Well, you're front and center, Pink.
Yes, Senator, I was wondering why the push for a public plan, a single-payer plan, when obviously the public seems very much against it. And if